Hi, I'm Cindy Jordan. I'm the CEO and co-founder of Pyx Health. So Pyx Health operates on a very simple premise. We engage your member population through companionship. So what I wanted to show here really quickly is, I know you guys told us not to spend a lot of time on the problem, but this is Janet, and she represents a member that we can all relate to. And Janet suffers a stroke. And despite the fact that she had all the right touch points with the healthcare system, Janet still ended up in an inpatient hospitalization. So why did that happen? Well, it's simply because there's all of these powerful influences and social determinants that are happening to Janet outside of the care setting. So for example, she lost her part-time job. She started to feel isolated. She's starting to feel depressed. She's starting to experience some food insecurities. So I think we can all agree that 90% of healthcare happens outside of the traditional care setting. So how do we solve it? Well, before we can solve it, we got to look back and learn from past lessons. And so when you think of member engagement platforms, traditionally in healthcare, they've done two things. They've created efficiencies, like book an appointment, and they've moved data from one place to another. What they haven't done is solve a pervasive pain point for the member. And at Pyx, we believe that pervasive pain point is loneliness, depression, and anxiety. Because if we can't offer the member something engaging on the platform, we're not going to be able to get to self-management and CBT techniques and those kinds of things. So how many of you in the room have experienced loneliness or depression in your lives or someone you know, right? It's going to be all of us. And you know that when you feel that way, you can't do anything else. You're kind of stuck. So what we do at Pyx is that we say that technology is not the solution, but it's the vehicle. So we're going to use technology to, one, build trust, two, to offer companionship, and then we're going to provide some self-management in order to help the member along their healthcare journey. Okay, so how do we do it? Now we're ready to talk about the solution. We do it through a little robot, a little chatbot, and his name is Pyxir, and that stands for Pyx, the intelligent robot. So I'll let him introduce himself.
Hi, I'm Pyxir, the empathetic, socially aware, interactive chatbot. My winning personality is the key to driving engagement. I have smart algorithms and understand the member's needs, providing resources and self-management in the moment that the member needs, driving down cost, and connecting members with their chosen natural supports and care team. I provide natural supports and care team insights into the member's well-being, making it easier to support them through the path. Here is an example of what the PyxPal sees. It's a dashboard specific to the member. There are actions the PyxPal can take through the application that alleviates the anxiety of not knowing what to say or being afraid of saying the wrong thing. This exponentially expands the member's care team. I leverage self-management and natural supports to improve the member's health journey without placing any extra burden on the healthcare team.
Okay, so Pyxir's a cute face, but is he smart? So we're going to talk a little bit about the smarts behind Pyxir and our cognitive services algorithm. You know, when we get the member on the platform and the member starts to engage, the first thing we do is measure disposition, and we do that every 2 weeks. And we use evidence-based screenings, much like MyStrength, GAD-7, PHQ-9, UCLA Loneliness Scale. And those scores inform how we feed CBT activities to the member throughout the platform. But the second thing we do is we get an everyday understanding about the member. And I think this is probably the most important thing, is like, how is the member feeling in that day, in that moment? So even though I might be lonely and depressed, today I'm happy. And if we don't acknowledge that with the member and just treat them like a diagnosis, they're going to stop using the platform. It's a barrier to utilization. So the everyday understanding, and we're going to show you a little bit about this in a second, that informs what self-management techniques we're going to feed in the moment. It also creates a one-to-one experience. So Pyxir is going to talk differently to me than they would to Nancy based on how we're feeling in the moment. The other thing we do is we know when a member is in an emergency room or a crisis center in the moment. So I always debate going down this path because it creates a lot of questions, but here's how we do it. The phone, every mobile phone in existence reports location. It's called location services. And we take that report and we draw a geofence around emergency rooms and crisis centers. And so when the two match up, we know that you're in an ED or in a crisis center, as long as you have your phone in your pocket, in your purse, or on your person. So we ask the member, we see that you're in the emergency room. Are you really there? And if they say yes, we say, are you there for yourself? And if they say yes, then we offer them the opportunity to talk to a 24/7 nurse hotline that's provided by our plan partners. And then we're going to show you what we do, but we also give that information right away back to our plan partners. And then the last thing we do on a monthly basis is take social determinants of health screenings. You know, we're going to spend all afternoon talking about how important this is, but you'll see here in a little bit how we handle it when we engage the natural supports. But all of this is the algorithm that kind of goes in Pyxir's brain and out his heart. Because this is all fantastic, but if we don't develop a trust with the member through the platform, we're not able to execute on any of these tenets of the cognitive services algorithm. Okay, so we don't have time for a demo, but what I'm going to do is just show you a few features. But before I do, I want you to take away two things. The first is that we believe that one size does not fit all. At Pyx, we are maniacally focused on Medicaid and Medicare members, and there's reasons for that, mostly because they have nuances around technology. So while 86% of them do have a smartphone, 52% don't have access to Wi-Fi. And if you start talking about complex member populations, that number goes exponentially up. So for example, we don't feed videos because whether it's true or not, members think they're data intensive. And if you're on a data plan that you pay as you go, you don't want to watch a video. The other thing is we know that our population is usually 3 to 4 generations behind in operating systems. So while I run a technology company and I would love to build for the iPhone 10, we don't do that. We don't build for the tablet or the 10. We build for the Samsung 4, which is what our members are carrying. The second thing I want you to take away as I just walk you through some of the features in the app is Pyxir's personality. I started by telling you that we focus on one simple thing, and that's companionship, because we don't want people to feel alone. If they feel alone, none of this good stuff can happen. So just see how Pyxir interacts with the member. So what you guys are looking at is the dashboard. When a member logs on, we try to offer some levity. In this instance, it was National Toast Day. And then we do some reminders where we push HEDIS measures that our plan partner gives us. And then, of course, it's really important, no matter who you are and what you're doing, to be able to see your progress in your journey. So we always let the member see how they're doing based on some of the assessments that they're taking in, little cute emojis. This is an example of how we measure disposition. Again, it's not a sterile form. It's not a checkbox. It's Pyxir asking questions. And then what Pyxir will do once we get an assessment is as he feeds cognitive behavioral therapy techniques, this is an example of a reframing. So the member said a negative statement, and instead of saying, well, why don't you try to do it this way, Pyxir says, I thought about what you said, and I'm thinking it might be better if you thought about it this way. The other thing we do is we store this in the database, and later, if the member scores poorly again, we'll say, hey, Pyxir will say, the last time I talked to you, you told me that you're a people person, and so this is the way that we create a unique experience. This is how we measure everyday understanding. Just for illustrative purposes, we're going to say the member feels happy. So what I like to tell people is imagine you're at a coffee shop with your friend, and my friend knows that I suffer from depression. I'm not going to sit down in the chair and my friend's going to go, Cindy, how's the depression going? Yeah, they're going to say, Cindy, how are you feeling? And I'm going to say, you know what, I'm having a great day. And we think that's so important to acknowledge. So Pyxir will acknowledge that you're feeling happy that day. And here's an opportunity to interject levity and humor into the application. Because what's the cornerstone of any good friendship? Humor. So I said happy, and Pyxir sent me a picture because Giphies don't use hardly any data at all of a bulldog sunbathing on the beach. And that's funny. It's almost as good as a hedgehog, but I couldn't work the hedgehog into the demo. So then Pyxir's going to offer self-management. And particularly when members are feeling good, we want to offer quick wins. Like, there's a lot of self-management about weight loss, but you're not going to do it and get on the scale at night and weigh 10 pounds less. So this one is, hey, you're happy? Sunshine is really important in staying happy. If you can't get outside for 15 minutes, like, open your blinds. This is something the member can do today, and they feel great about it. Okay, social determinants of health. This is an example of a screening. Again, back to the coffee shop. If I tell you I'm having food insecurities, I don't want to wait 2 weeks for you to call me and tell me what to do. So what the app does is intervene in the moment. Because we know where the member is, we can say you're 0.4 miles away from a food bank. And if you can't get there, here's the phone number. So this is real-time intervention around SDOH indicators. The other thing we do, and this is very exciting, we give the information to you. So we send all that data back to the plan, but we also let the natural supports know. And I haven't spent a lot of time on this, and I want to give Christina time, but I started Pyx Health because my stepdaughter was diagnosed with bipolar, and it is a crazy journey. And in particular, there was one year that was very hard. And one of the things that was hard for me is that she had been in the ED, she's an adult, she had quit school, and I had no idea. And I thought there has to be a piece of technology that can help her, but also help me intervene. So when a member chooses to put a natural support on the platform, if they're in an ED, or they feel bad that day, or their trend is low, or they have a social determinants of health need, we let the natural supports know. Now I'll turn it over to Christina, our Vice President of Operations, because just like you guys, I shouldn't be talking the numbers.
So before I joined the Pyx Health team, I sat in your chairs. I was at an Arizona MCO, so today kind of feels like coming home. But working in an innovative payer environment, you really understand and learn about the importance of risk stratification, not only in identifying need, but delivering personalized services and care. So we pair our technology with that same strategy. So your priority populations are ours. Many times that's the top 20% based on your risk stratification. So there's a lot of work to do. So the things that we take really seriously is the delivery of our tool. So our resources wrap around that population. We do the following things. So direct phone outreach and targeted mail. So that's kind of the cornerstone of lots of technology solutions. But why we're so successful in that area is because we're very intentional with our efforts. So there's a live person on the phone when we do calls, and we're very targeted in our messaging by segment of this population. We also understand and honor the trusted relationship between the provider and the member and the care manager and the member. So we spend time with both of those roles, doing train the trainers, providing resources, because when a referral is made between the care manager or the provider and the member, we see a 91% adoption rate. We also are in transitions of care, so a lot of times this population is moving care settings. And so whether that's to a level down or into the community, if we're providing Pyx as the resource, we're giving them the tool to connect and be supported by the plan and the natural supports. And then finally, I want to highlight this because it's exciting. We are really passionate about being in the relationship with the payer and the provider, in the sense that we want to be the tool that helps providers achieve their quality metrics tied to their value-based purchasing by supporting members. So with all of that said, I'll say this quickly. We want to provide this tool to anyone who identifies with it. So through education and partnership with the plan, we like to do a lot of that with you through plan-sponsored communications for the rest of your population. All right, so do you have member engagement if people don't use it? No. But we take this really seriously. So we don't look at downloads, we look at sustained and meaningful engagement. So 67% of the users or the members who download our platform stay on for at least 30 days. And what we like to see is that they're using it and completing interactions, so 20, an average of 20 in the first 30 days, and that means they're going on and taking screenings, they're getting cognitive behavioral therapy techniques. And so that to us is really important because they are building a trusted relationship, and that's seen in the next stat even more. So after 60 days, they're at 129 interactions. So if you see that jump from 20 to 129, once we get them, they trust us. Yesterday at the Healthy Communities Conference, I think if anyone were there, the keynote speaker said that data is just humans with tears wiped off. And I thought that was really powerful when you're talking about member engagement, because the ultimate goal is reducing cost, improving outcomes. But if you're not going back to the member and seeing how these tools are impacting their lives, I think you will never achieve those. So our members, not only our engagement numbers are telling us that there's trust, but 88% of our users say that they go to our app when they need help. 88% said that they felt healthier after just 30 days. And then finally, 65% of them felt more connected to their healthcare team, so all of you. So not only do they feel connected to their natural supports, but it's making them feel connected to their health plans.
Okay, so Pyxir is thanking you from the bottom of his hard drive, and we're thanking you. I realize this is a short amount of time, and so while we didn't get into the details of the how, I wanted you to understand the why. Why do we do this, and why is it working? And so with that, we'll take some questions.